Hi, everyone. My name is Jethro, and I am presenting on health equity for First Nations children, the past, present, and future of Jordan's Principle. To begin, I would like to respectfully acknowledge that I'm joining you today from Ottawa on the unceded traditional lands of the Algonquin Anishinaabe, who have inhabited and cared for these lands since time immemorial. I completed my practicum placement at Indigenous Services Canada with the Jordan's Principle National Policy Team. Jordan's Principle is named in memory of Jordan River Anderson, a young boy from Norway House Cree Nation. Jordan passed away in 2005 without ever having left the hospital because the federal and provincial governments could not agree on who would pay for his home-based care. Today, Jordan's Principle is a child-first initiative that aims to provide First Nations children with the health, educational, and social products, services, and supports they need when they need it. During the practicum, I had an opportunity to research and to reflect upon the past, present, and future of Jordan's Principle in terms of its public health implications. Fundamentally, Jordan's Principle is a response to health inequities and social injustices experienced by First Nations children, and it is situated at the intersection of three key issues. First, Jordan's Principle aims to support the health and the social determinants of health for First Nations children. Second, Jordan's Principle emerged from a human rights case alleging discrimination against First Nations children. And third, Jordan's Principle was designed to address jurisdictional disputes around which level of government is responsible for delivering services to First Nations. Over the years, Jordan's Principle has evolved in response to a series of Canadian Human Rights Tribunal orders. And these orders have addressed several key questions. When does Jordan's Principle apply? Who is eligible and what is covered? Initially in 2007, Jordan's Principle was applicable for intergovernmental jurisdictional disputes involving First Nations children living on reserve who have multiple disabilities requiring services from multiple service providers. Today, Jordan's Principle is applicable regardless of a jurisdictional dispute for all eligible First Nations children on and off reserve, and for a broad range of health, educational, and social products, services, and supports. Progress can be measured in many different ways. For Jordan's Principle, there are metrics like the number of approved requests and the amount of funding associated with those requests. But from a public health perspective, it is also important to consider how Jordan's Principle aligns with public health priorities. For example, Jordan's Principle aligns with the goal of health equity through its application of something called substantive equality. This is a legal concept recognizing that those in positions of greater disadvantage should receive a proportionately greater level of support. Accordingly, Jordan's Principle requests are handled on a case-by-case basis, taking into consideration the underlying circumstances of each child, such as their health condition, their family context, and their location. Jordan's Principle also aligns with a social determinants of health perspective by providing broad coverage for the needs of First Nations children. In centering the best interests of each child, Jordan's Principle recognizes that well-being extends across multiple domains, including cultural continuity, access to services, education, and other determinants of health. I don't know exactly what the long-term approach to Jordan's Principle will look like. I probably have more questions than I did at the start of the practicum. But as it continues to evolve, there are several themes and questions that would be important public health considerations. First is addressing gaps in coverage. What about eligibility for children who have lost connection to their First Nation, especially as a result of colonial policies? What about discrepancies on and off reserve, such as the unique barriers experienced in remote communities? Second is providing holistic and upstream support. What does a proactive and preventive approach look like so that Jordan's principle is not only responding to emerging needs, but also reducing future demand for support? Third is respecting Indigenous self-determination. What does the transfer of service design and delivery to First Nations look like in the context of Jordan's principle? And fourth is pursuing systemic and structural change. How can the underlying jurisdictional gaps in services to First Nations be closed? And on a broader level, how can Jordan's principle advance the work of reconciliation? The Truth and Reconciliation Commission calls upon all levels of government to fully implement Jordan's principle. But what exactly is meant by full implementation? And what role does public health and its priorities play alongside other considerations? Regardless of what the long-term approach to Jordan's principle entails, the path to health equity for First Nations children involves centering their rights and their well-being, working collaboratively with First Nations and all levels of government, and respecting Indigenous self-determination in the journey towards reconciliation. Thank you.